Hello everyone. Today I'll be continuing with the topic surveying. So in this picture you can see two teeth. I have drawn two lines on the labial surface of both of the teeth. Here you can see this line is contacting at a single point on this particular tooth. The same happens with this tooth as well. So the region below this line, the triangular space between the line and the tooth is called undercut. The same is here. The triangular space which is present between the tooth and the line is called undercut. So we know that for a cast partial denture, there are few components. One is major connector, then minor connector, direct retainer, indirect retainer, and denture base minor connector. Then teeth. Okay. So for direct retention or to retain the RPD in patient's mouth, we need to give clasp. So the direct retention is provided by clasps. It can be extracoronal retainer or intracoronal retainer. Now we'll be discussing about extracoronal retainers. Extracoronal retainers are nothing but the clasp. Okay, so when we give a clasp, the clasp should engage the undercut. Here you can see this is the undercut. So the retentive terminal of the clasp should be engaging this area. Okay, same for this tooth as well. Okay, so if there is undercut, the surveyor will help us to locate the undercut of a particular tooth. It's not necessary that there is undercut in all the cases. So the surveyor helps in locating and delineating the contour of the tooth. In a simpler way, the surveyor will help us to find out where the undercut is and where the height of contour is. This particular point where the green line is contacting the tooth is called height of contour. But without use of a surveyor, we cannot find out where the undercut is and where the height of contour is seen at a particular plane. Keep this in mind that the undercut and the height of contour will change according to the plane. Okay. In this figure, you can see three teeth. The same tooth but at different angulation. Okay. Here the long axis is parallel to the vertical plane. Here it is slightly distally inclined. Here it is slightly mesially inclined. And I have marked the amount of undercut present in these three teeth. Okay. When it is parallel to the long axis, you can see how much undercut is present. And when it is distally inclined, the undercut is getting decreased. When it is mesially inclined, undercut is getting increased. Okay. So by changing the plane or tilt of the cast, we can either increase or decrease the undercut present in a tooth. By changing or tilting the cast, the height of contour also getting changed. In this tooth, the height of contour is in the junction of middle and cervical third, but it is coming down more. Here, the height of contour is getting towards the occlusal and middle one third. Okay. So if there is no undercut on a particular abutment in the horizontal tilt, then there won't be any undercut in the reality. Okay, so by changing the tilt of the cast, I mean left laterally or right laterally, won't result in any undercut. So in such cases, we have to create undercut on the tooth. Okay, by recontouring of the tooth or by giving a surveyed crown. This is a very important concept. This is a very good example for what I have been said. Here, the cast has been kept parallel to the horizontal plane. These are the two primary abutments, and the author has been tried to draw survey lines on these abutments. From this image, it is quite obvious that there are no undercuts on these two abutments. Okay, but when they try to change the tilt of the cast, you can see undercuts are present. The area beneath the survey line is called undercut, right? So there are undercuts on both of these two primary abutments. Okay, the prosthesis has been fabricated according to this tilt and you can see that the retentive terminal is engaging the undercut. Okay, but when we tilt or bring the cast back to the original position or bringing the cast to the horizontal plane, you can see there is no visible undercuts, and ultimately the prosthesis fabricated will be of no retention. So my conclusion is that in the horizontal plane, if there is no undercut, then there is no undercut or there is no retention for the prosthesis. If we tilt the cast, you can see that undercuts are begin to appear, right? By changing the tilt of the cast, the quantity or the magnitude of the undercut is getting increased. But when we bring back the cast to the original position, okay, the prosthesis will not be of any retention. So my conclusion is that when the cast is returned to a horizontal orientation, the perceived undercuts disappear. This lack of retention becomes evident when the cast is inverted, as would occur in maxillary application. Such a framework is of questionable clinical value. I hope that it is clear.